There is a folder in the basement archive of the Dunmore Institute for Child Welfare Studies, catalogued under reference D-4491, that contains the intake records for a nutritional research program conducted between the years of Provisional Accord 14 and Provisional Accord 19. The folder is not sealed. It is not restricted. It has simply not been requested by any outside researcher in the 43 years since it was transferred from the Institute's original facility to its current location. I found it because I was looking for something adjacent: discharge records for the Harwick Children's Home, a residential institution that operated on the same grounds during the same period. What I found inside D-4491 was not what I expected. What I found was a study. The Harwick Children's Home was established in Provisional Accord 3 under the auspices of the Regional Welfare Directorate, a body responsible for the administration of residential care facilities across the Dunmore province. The home housed between 60 and 90 children at any given time, orphaned, abandoned, or transferred from families deemed unable to provide adequate care. The children ranged in age from infancy to 16. The facility's stated mission, documented in its founding charter, was the provision of stable residential care, basic education, and sound nutritional practice for children in the custody of the Directorate. The nutritional component of that mission is where the study begins. In Provisional Accord 14, the Dunmore Institute for Child Welfare Studies entered into a formal research agreement with the home. The agreement, preserved in DI-4491, describes the study's purpose as an investigation into the absorption rates of mineral compounds in developing digestive systems, with particular attention to the role of dietary supplementation in childhood growth outcomes. The language is administrative and precise. The study would be conducted over 5 years. Participants would be children resident at the home between the ages of 4 and 12. Breakfast meals would be modified to include a proprietary mineral supplement developed by the Institute's nutrition laboratory. Outcomes would be measured quarterly through height, weight, and what the agreement describes as internal tissue response indicators. The agreement is signed by the home's director, a man named Casper Veld, and by the Institute's lead researcher, identified in the document only by the designation Dr. T. Orphan. Neither name appears in any other document I was able to locate in the public record. But here is the detail that doesn't settle easily. The study's intake records, the documents listing which children participated, are organized by dormitory group rather than by name. Each child is assigned a participant code, a letter, and a number. D-7, F-12, B-3. The codes appear consistently across 5 years of quarterly reports. What the records do not contain anywhere is a key. There is no document in DI-4491 that translates participant codes into the children's actual names. The codes were assigned at intake. The key, if it ever existed as a separate document, is not present in this folder. And I found no record of it existing elsewhere in the Institute's catalog. ID 1 children participated in a 5-year nutritional study. Not one of them is identified by name in the research record. The quarterly outcome reports record participant codes, age ranges, dormitory assignments, seasonal meal schedules, and supplement dosages. The supplement is referred to throughout as compound 7 gravis. Its composition listed only partially. A mineral matrix, incorporating trace elemental compounds selected for bioavailability in juvenile digestive systems. The specific elements are not named. The reports cite an internal specification document, reference LB-77, for full compositional details. LB-77 is not in DI-4491. It does not appear in any publicly accessible record. And this is where the pattern becomes harder to set aside. In Provisional Accord 17, the 3rd year of the study, the quarterly report format changes. The first 2 years of reports follow a consistent template: participant codes, measurements, supplement schedule, outcome notes. The Year 3 report introduces a new column in the outcome tables, secondary indicators. The column heading appears without definition or explanation, as if it had always been part of the template. The entries in the secondary indicators column are numerical values between 0.3 and 4.1, recorded to one decimal place. No unit of measurement is provided. No reference document explains what the numbers represent. The secondary indicators column appears in every quarterly report from Provisional Accord 17 through the study's conclusion in Provisional Accord 19. The values trend upward across most participant codes over those 3 years. In 14 cases, the value reaches 4.0 or above by the final quarter. In the column beside those 14 entries, under the heading Continued Participation, the notation reads, Deferred, see Administrative Transfer Record. I searched for the administrative transfer records. They are not in D-4491. They are not in the Home's General Administrative Files, which survive in partial form in the Regional Welfare Directorate's archive. I found one transfer record, a single page, filed incorrectly in a folder of building maintenance requests from the same period. The record documents the transfer of 7 children from the home to the Dunmore Provincial Medical Facility in Provisional Accord 18. The reason for transfer is listed as nutritional study, follow, on clinical assessment. The children are identified by participant codes only. The medical facility's intake logs for Provisional Accord 18 do not appear in any archive I was able to access. 7 children transferred mid-study, their destinations are on record. What happened at those destinations is not. Reasonable, perhaps clinical studies sometimes require medical follow-up taken alone, an unremarkable administrative action except for one detail. The transfer record lists 7 children, the final quarterly reports from Provisional Accord 19. The studies last year show 14 participant codes with secondary indicator values of 4.0 or above. 7 were transferred in Provisional Accord 18. The remaining 7 continued in the study through its conclusion. Their final outcome entries in the last quarterly report carry the same notation, deferred, see administrative transfer record. No transfer record for those 7 exists in any document I found. 14 children with elevated readings of an unspecified measurement. 7 transferred mid-study with no traceable destination. 7 retained through conclusion with no documented outcome. Not one identified by name. Now here is where the testimony enters. The Dunmore Institute maintained an oral history project in later decades, interviewing former staff about facilities and programs from the Provisional Accord era. The recordings are partially transcribed. One transcript stands apart. It is an interview conducted in later years with a woman identified only as a former residential care worker. Harwick Facility, Pennsylvania 13, Fay 20. She is not named in the transcript. She describes her time at the home in general terms, the children, the routines, the staffing. Before the interviewer asks about the nutritional study, her response, as transcribed, is as follows. The breakfast was different for the study group. They had a separate table in the morning. The powder went into their porridge. We were told it was a vitamin supplement. We were not told anything else. I noticed that the children at the separate table seemed tired more often, quieter. I mentioned it once to the director. He said the supplement sometimes caused mild fatigue and that it was not a concern. I did not mention it again. The interviewer asks whether she knew what the supplement contained. She says, "Number we weren't told. The jars came from the institute. They were brown glass. There was a label with a code on it. I remember the code because it was always the same 7G. 7G compound 7 gravis. The supplement administered across 5 years to 81 children, whose names do not appear in the research record." The woman continues, "After the study ended, the institute people left. The director left shortly after. I don't know where he went. I stayed another year." By then, the study children had been redistributed to other dormitories. I don't know what happened to the ones who were transferred out during the study. I asked once and was told they had been placed with families. I didn't ask again. Placed with families. The transfer record, the one page filed among building maintenance requests, describes the destination as the Dunmore Provincial Medical Facility, not family placement, a clinical facility. I tried to trace the study's conclusion. Research agreements of this type, filed through the Regional Welfare Directorate, required a formal completion report to be submitted to the Directorate's Oversight Board within 6 months of study conclusion. The Oversight Board's records from Provisional Accord 19 and 20 are preserved in the Directorate's main archive. I found no completion report for the Harwick nutritional study. I found no reference to di-4491 or to compound 7 gravis in any Directorate oversight document. The study was initiated through a formal agreement. It ran for 5 years. It produced 12 quarterly reports. It was never formally concluded in any administrative record outside its own folder. And here is perhaps the detail I return to most. The Dunmore Institute for Child Welfare Studies published an annual research bulletin throughout the Provisional Accord era. The bulletins listed ongoing and completed studies, summarized findings, and credited lead researchers. I reviewed every bulletin from Provisional Accord 14 through Provisional Accord 22. The Harwick nutritional study does not appear in any of them. Not as ongoing, not as completed, not as discontinued. Dr. T. Orphan, the lead researcher named in the study agreement, is not credited in any bulletin from any year. I searched the Institute's staff registry, its published research index, and its commemorative history volume. The name appears nowhere except on the signature line of the agreement in folder di-4491, AF5. Year study. 81 children. 12 quarterly reports. One former care worker who remembered brown glass jars with a code she never forgot. And a lead researcher who, outside of a single signed agreement, appears to have left no trace in the institution that employed him. The folder is still in the basement archive of the Dunmore Institute, catalogued under di-4491. Not sealed, not restricted, waiting, the way things wait when no one has thought to ask for them. The brown glass jars are gone. The children's names were never written down, and the column labeled secondary indicators still runs its numbers up the page, recording something, in units no surviving document has ever named.